Hi, this is Marco from Our Hope Treatment. We are a specialized clinic for TMS therapies from Evanston, Illinois. I will answer the most common questions we receive. Hopefully, this will help you to better understand what is TMS and how it can help you or your family. Let's start with the most common question. What is the difference between standard TMS and PRTMS? The traditional version of TMS is designed that one protocol fits everybody. It is widely used for treatment of depression and OCD. It is FDA approved. This protocol really works even though it treats only one location, which is approximately the left side here. And it works because the MRI actually showed that this is the location, the problematic area for depression and OCD. Comparing to traditional TMS, personalized version addresses more complex disorders such as autism spectrum, TBIs, PTSDs, and many others. Because we understand that these are more complex and involves different locations of the brain. We need something which is personalized for every and each patient. That is exactly what PRTMS is. So it's every patient has its own protocol designed by the neurocognitive survey results and EEG results. One very big difference between TMS and PRTMS is the intensity of treatment. Traditional TMS is using motor threshold to determine the intensity of the therapy. This goes probably from around 50% to 80% intensity, which is pretty high comparing to personalized version. Personalized version allows creating the protocol which is using much less intensity, let's say from 18 to 34, which is the maximum we ever used for treatment. This means that the side effects of PRTMS are much more less, even though traditional TMS is extremely safe. This brings us to the next question, which is the side effects of both these TMS protocols. It is important to know that TMS treatments are very safe. The most common side effects are scalp discomfort or pain and a headache. During TMS treatment, some individuals may experience mild discomfort or pain at the treatment site on the scalp. This is usually temporary and it's more common with standardized TMS. The reason is that standard TMS is using higher intensity for the treatments comparing to personalized versions. Headaches are common side effects of TMS. They're usually mild and short-lived, resolve on their own and with the over-the-counter pain medication. We are also recommending for our patients that they add additional glucose before and after the treatment. Usually this resolves the headache. While very rare, TMS has been associated with the increased risk of seizures, particularly in individuals with a history of seizures and other risk factors. Before undergoing TMS therapies, individuals are usually scanned to identify any factors that might increase the risk of seizures. We use EEG, neurocognitive surveys. We have consultations with the primaries, neurologists to make sure that the patient is safe to use TMS, and then we start recommending it and start applying it. To answer the question what kind of disorders we can treat with TMS therapies, we have to understand what exactly TMS does to our brain. So brain has different parts. All of these parts have different functions, and in order for us to function well, the communication between those parts needs to be perfect. So usually with neurological disorders, this is where the problem is. The parts of the brain do not work on the same frequency and they don't communicate. So since TMS therapies are synchronizing those neurons to work as a whole, to work as a one, so that means that we can address a wide spectrum of neurological disorders. Previously, we said depression, we said OCD, but also we can treat TBIs, brain traumas. We can treat autism disorder. We can treat tinnitus or intellectual disability. Yes, those are some where TMS therapies are very effective. The last question for today is, what was the best outcome we had at our Hope treatment? I would say that treating teenagers with ADHD is where we had the most success so far. Parents bring kids with ADHD where they're struggling to keep focus, perform daily routines, control impulses, and parents complain about the grades. But truth is that these kids have trouble staying concentrated, and memorizing is even bigger problem. It is amazing how after 8-9 weeks things start to change. Peak performance actually starts after 2 to 3 months after the treatment. We have report cards from parents showing unbelievable results. They're calling us saying that their kids became BNA students. And we also have a great success with preschoolers and school-aged kids who had a constant incidents at school. Their problem is impulse and body movement control. We were able to correct those bad behaviors, and it took us about 10 weeks of therapies. Again, results are the most visible after 2 to 3 months after treatment. Sometimes parents are not satisfied with the results during the treatment and they cancel it after 4-5 weeks, and they came after 2-3 months saying, hey, my kid is doing much better, so let's see what we can do. So we again do the EEG, we continue with the treatment, and we are very confident that we can help wide range of people. For any additional questions, please don't hesitate to email me, text me, call me, or just schedule a consultation with us in our Hope treatment clinic. Thank you so much for having me today.